saw people roll in, but you know what, Manal, I know we're only doing 30 minutes today, so I say
Yeah.
we get started. So why don't you go ahead and intro us?
Yeah, sure. So I'm Manal for anyone who doesn't know me, and I'm the digital marketing specialist for Case Invade. I'm doing all the social media posts, emails, and also taking care of our website to look pretty. Lately, I've been posting on Instagram about 2023 predictions and everything, and we also ask people to ask us questions. So I will just start, Dr. J, ask you questions. We had bunch of repeated questions, so I just took the more relevant so we can have all of this in 30 minutes. So first question, Dr. J, it's what are the trends you noticed in the chiropractic industry this year?
Yeah, what I noticed in 2022, speaking around the country and visiting our customers, is that the practice volumes were down this year. 2021 was a really strong year for a lot of chiropractors. And I'm not saying, practices were down for everyone, but noticeably the conversations, that I was having with our customers and also with other people in my mastermind groups is that volume was down. New patient acquisition was down, total volume was down, revenue was down. And so, you have to find creative ways to help change that. You've got to find ways to drive more value for the consumers and the communities that we're serving. And so, and we could talk about that as it relates to 2023, but that was one trend that I definitely noticed. One of the other trends that I noticed, again, speaking to our customers and speaking at conferences, was that staffing challenges probably were harder than ever this past year. Unemployment is really, really low, was really low in this past year. And of course, before that, there was the Great Resignation. And so I think people have had challenges, us included, staffing our clinics. And, we actually have a challenge right now. I'm happy to share. People who know me know I'm very transparent. In one of our clinics, we're looking to hire a couple of additional CAs, and it's just been really difficult. I'm shocked by the behavior of people, everything from ghosting, like not showing up for their interviews, to just people being really rude. I'll share this really quick story. Chrissy, who's our recruiter, and by the way, I highly recommend you find someone to do recruiting for you if you have staffing challenges. Makes a huge difference. We found our recruiter on LinkedIn. She's a part-time 1099 contractor. She's amazing. And so offboarding that to someone else, using someone who can do that for you can save a lot of time and ultimately a lot of money. But anyways, she sent me this email. She's like, do you think we should interview this guy, LOL? And she's like, he sent this email previously when he applied for the job before, and he wrote, I'm not interested in your job. I'm not interested in your company. I don't want to work for you. Basically like, please leave me alone. And then he applied for the job again. So he applied twice, but he responded with that email. Now, I don't know if he sent it to the wrong person or what, but I'm like, people are just bizarre. So staffing has definitely been an issue in 2022. And we'll talk about, more strategies moving forward for 2023. And I think with a positive trend that I've seen is greater insurance company scrutiny, Manal. I've seen lots and lots of articles around insurance companies essentially getting caught for fraud. Brad and I, we speak, on stages all over the planet, and, we teach around technology, and we talk about how we have to leverage big data in order to understand how insurance companies are treating providers. And thank God for Brad Koss. He's the CEO of Infinity and QVH Analytics Systems. And he's aggregating data from 10,000 chiropractors, his customers, and we're able to identify abuses that we can see. And I'll talk more about that as it relates to trends in 2023. But when we teach, I've been able to share more articles around things like Aetna and Optum planting a dummy code for reimbursement where patients and or providers are inappropriately paying for an admin fee that Aetna should be paying Optum. You can Google that, guys. It's on the interwebs. You can find that article. Anthem or Horizon Blue Cross recently is coming up against fraud charges because they were actually charging the state of New Jersey double to what the actual providers were charging Horizon. And so I think what we're seeing is greater insurance company scrutiny. Also, I received a video from a friend that that talks about how insurance companies are now, they're no longer freed up from antitrust cases and litigation. So they now have to adhere to all the antitrust laws in our country, where previously that wasn't the case. So I think we're going to continue to see that scrutiny moving forward.
Okay. I'll go to the second question.
Sure.
What is the most inconsistent thing you have noticed providers doing in 2022?
I think the most inconsistent thing I've noticed providers doing is being consistently inconsistent. Again, when I'm consulting with our clients and talking about the importance of metrics and KPIs and data, there's still a huge gap in terms of kind of where most chiropractors are and where they really need to be. And I think, we're helping to close that gap, but it needs to be better. I think they need to be more consistent with setting appropriate SMART goals. They need to be more consistent with identifying what those key performance indicators are and what the driving factors are, what the leading metrics are for those KPIs. I'm in a hotel room. I was like, I call the front desk. I'm like, please don't come in before 12 noon California time, because I'm doing a nationwide webinar. You just walk through the door. Never fails. So again, understanding the KPIs that drive their business, understanding the leading metrics that drive those KPIs. And then I think the other really inconsistent thing that I'm seeing providers continue to do is their one-on-ones and their regular staff meetings across the board. You know me, I'm very consistent with my one-on-ones. I don't miss them. I've got we've got level 10s every single week with my direct reports. I just don't miss them. And so the more communication that we have with our team, the more we understand where they're at, and I think the more we can support them. I was in a text thread earlier this week, and someone had said, unfortunately, 2 of his key staff members were leaving, and my thought was, God, that's terrible. That's really, really hard. And we never want to be surprised. It's okay if people want to leave. It's totally fine. But you want to have a relationship where you've built trust with someone, where they can come to you even before they start looking and say, I'm not happy. I'd like to be doing X. Right now I'm doing Y. How about we work on creating a win for both of us, creating a win for me in my next role, and creating a win for the company, where we can bring in somebody who can do an even better job than me in this role. And people can do that. And I think having regular one-on-ones and meetings is really important. So for the providers out there, set appropriate goals, understand your KPIs and your metrics, and really, please, please, please have regular one-on-ones and weekly meetings with your team.
Yeah, transparency is the key.
It is.
Yeah, and goals, even like in personal life, are important.
100%.
Yeah.
Yep.
We've got a question from Michael Coates. We'll go over our questions, and then please feel free to put any question you have, and we will answer them at the end of our session.
100%.
Dr. J, top innovation in 2022.
I think the advent, and certainly in the chiropractic profession, and again, I want to give a huge shout out to Brad, but I think the advent of big data and how we're using big data and dashboards in our practices is making a significant difference for us in understanding how insurance companies are behaving. So big data, a really important innovation for the chiropractic profession in 2022. And Brad and I are really leading that charge, and we're able to leverage Infinity for that work. So if you're using a clearinghouse and you think it's quote unquote free, it's not free, because they're using that data against you, because many of these clearinghouses that are free are owned by the insurance company. So we need to move people to Infinity so we have large aggregate data for the chiropractic profession. And I think another innovation that I think we're leveraging a lot in our practices is a platform called SEMrush. It helps us identify what people are searching for, what answers they're looking for. And it helps us really shape our content marketing so that we can really support both our patients on the Kaizo Health side and our customers on the Kaizennovate side. And then I think the third really interesting innovation that just came across my desk in the last several weeks are AI chats. There's a platform called ChatGTB It's funny, I was talking to folks in my accountability group about it, and then Brad and I were taping one of our podcasts, and he brought it up, and it was just super interesting that this is really, starting to show up on people's radar. And I played with it a little bit the other day, and I thought it was really, really interesting. In fact, I put the question in the search bar. I said, what is the most appropriate treatment for low back pain? And it came back with, the most appropriate treatment is physical therapy and exercise. And it didn't include chiropractic or spinal manipulation. And it's supposed to learn over time. And so I was like, wrong answer. You did not, all the clinical practice guidelines internationally, say that really the two most effective forms of treatment for low back pain are spinal manipulation and exercise. And so that needs to be included. And of course I hashtag chiropractic, and I just made sure that we're going to teach this thing how to learn. So really interesting innovation that I think is going to, it's kind of the zeitgeist of the moment, but I think we're going to see growth in that area for sure.
Yeah. So we talked about 2022, and now we are going, we're also excited about 2023. So let me start with that first question which is team retention. Who do you need or not need in 2023?
It's a great question, Manal. So I think first and foremost, as it relates to, team retention, it is all about having a recruiting strategy. Now, you guys if you've been on my webinars this year, you've seen me talk about it several times. You have to have a recruiting strategy. Each one of our positions is actually posted for all of our companies, for all of our positions. And we're getting applicants that come in every single day. Why is that important? Because when someone decides to leave, you now have a pipeline of candidates that you can talk to. And some people are like, oh my God, I'm so afraid. I don't want to do that because then people are going to think like I'm going to replace my best people. And of course you're not. And in fact, your best people want you to be recruiting because they want to work with the best people. So your A players are like, cool, let's bring on the best possible people on this team. So who do you need and not need? Who you need is the person who aligns with your core values and your mission. So when you do your interviewing process, you've got to interview for behavior and values. When it comes to the types of positions, that really is very, very clinic independent. Most of you probably know this, some of you may not, but we don't have front desk CAs anymore. After COVID, we were like, forget this. I'm not going to have somebody sitting at the front desk on their phone half the time. Just not going to happen. And so what we did is we centralized all of our operations. So we've got people literally remotely all over the United States, Colorado, South Carolina, Virginia, all over. And Pennsylvania, Manal's in Pennsylvania, and Pakistan. We have one of our Kaizen of 8 team members who's in Pakistan.
I've been working from Morocco.
Yeah, you work from Morocco, exactly. But we have a centralized operations team, and we were able to manage things centrally at a much lower cost, a much lower hassle, and now everybody in the clinic are revenue producing people. Our clinical CAs do some admin work, but not nearly as much as obviously the front desk CAs do. It's all handled centrally. So I think you've just got to make sure that you've got a recruiting strategy, you're interviewing for behaviors and values, and you're hiring the right people, and they're in the right seat, doing the right work in the right way at the right time. That's what you really need. Then you've got to work to continue to develop them. One of the things that makes me really, really happy about my job is that I get to see people grow in their roles. I'm not the same person I was a year ago, 5 years ago, 20 years ago. Thank God, because I was a terrible boss 20 years ago. And I think, when we get to lead a team and we get to see their development, their growth, and ultimately their impact towards the mission of the organization, man, that's the key. So make sure you've got a recruiting strategy, hire the right people, make sure they're in the right seat, work to develop them, invest in them. We have consultants that we bring in to teach us things that otherwise we wouldn't know. But that helps us do our jobs better, and that helps develop our entire team. And again, I've said this earlier, you just got to build your relationships with your people. Believe it or not, if you're a good boss, and I'm sure most of you, if not all of you are, they want your time. That's the most valuable asset that you can give them. It's a gift, right? You give them the gift of your time. And when you give of your time, they're super appreciative, strengthens the relationship, strengthens trust, and then things just get better from there.
Yeah. And moving to your predictions, Dr. J, in 2023.
Yeah, so I mean, I've actually, listen, I don't have a crystal ball. I wish I did. I totally wish I did. Manal, maybe we need to work on that.
Yeah.
But I don't have a crystal ball, but I've done some research, and there seems to be some pretty consistent themes. The first consistent theme is that economic growth is going to slow, but we may not actually head into a recession per se.
Yeah.
So pricing is not going to be as high. Inflation's not going to be as high. Growth will slow, and that's going to lead us to kind of the second part of this that I've seen, again, consistently across the board when I've done my research, which is the labor market's going to shift. There's going to be a bounce back. There's going to be probably a bit more unemployment than there is right now. You saw what some of these large technology companies are doing. Facebook, Twitter, they've laid off a lot of people. And I think that's probably going to continue, especially as economic growth slows. And I think that gives us an opportunity, again, have a recruiting strategy and just interview, right? Just interview. You may not even have an open position, but you might find somebody in that interview process. You're like, God, this person's so good. I don't know exactly what role they would be in. Maybe it's a new role. I don't have to replace anybody, but maybe it's a new role that can really help us grow our business. I've done that countless times. Manal is our first digital marketing rep ever for Kaizennovate. Like, we didn't have that role. And so, but we love Manal. And so we're like, we gotta find a place for her. And she's been amazing. So again, I think economic growth is going to slow, and I think we're going to have more choices as it relates to the labor market, but I don't think it's going to happen in the first quarter. It's probably going to be more like Q2, Q3. I also think, and I have a strong bias, I fully admit I have a strong bias around this, but patients are expecting a digital health experience. Now, I say that as a tech entrepreneur. I say that as a person who builds digital technology to engage patients. But I've also done a ton of research on this, research that is online, and research in talking to other technology entrepreneurs, and research talking to patients. I think one of the challenges and one of the reasons why we experienced a bit slower growth in chiropractic practices this year is because sometimes it's just hard to get to the chiropractor. So how do we provide them with a digital experience where we can stay connected to them, and when they need to come in, they come in, but we have more connection with them when they're outside of the practice. We're launching our second product. We're literally in beta testing right now. And it was really funny. I was walking my dogs the other day, right? And I see my mechanic. He's our mechanic that has a shop across the street from our alleyway. And he's in a walking boot. And I'm like, bro, what happened? And he's like, oh man, I was playing soccer and I had this really bad high ankle sprain. Now, I wasn't like trying to get him as a patient or whatever. He's in DC. My practices are in the periphery, in the suburbs. It'd be really hard for him to get to us. So I was like, well, and I was thinking to myself, well, we have 2.0, our second product, and we have an exercise artificial intelligence algorithm, and I can pre-populate that for him based on his diagnosis. And let's see if I can help him while he's at home. So I did. We got him launched on the beta product, and like, he was blown away, and he was really excited to have some level of care because the stupid orthopedic surgeon put him in a boot and gave him no exercises or no prescription for future physical therapy. Like, when it feels better, take the boot off. I'm like, OMG. It makes me want to scream. So we have to be able to provide a digital solution for our patients. And I truly believe that the practices that provide digital solutions for their patients are going to be the winners moving forward. Strong opinion.
Yeah, for sure. Yeah. And everything is now digitalized, and we need to not be left behind, and just
And the physical therapy, I mean, the medicine's already doing it, right? Like, they've engaged highly in telehealth. Physical therapy has engaged very strongly in digital health. And this is another trend that I think we're going to be seeing in 2023. And we are literally going to lead the charge on this for Kaizennovate and for our customers. But there are new codes that CMS has put out. They're called remote therapeutic monitoring and remote patient monitoring codes. And the physical therapy industry is about 5 years ahead of chiropractic. But we've built this second product. We're calling it 2.0 because we don't have a name for it. Full disclosure, we still don't know what we're going to call it. We're hoping one of our customers says, hey, you should call it this. And give us an idea. We're going to crowdsource the name. But what I want you guys to understand is that we can build these codes. We have literally built our second product. It has been classified now as software as a medical device. We've gotten a legal opinion from a very, very good health tech law firm in DC. And we actually had a second and third opinions as well. And so what happens is when practices use our technology, they stay more connected to the patient. We think, we're going to study this, we've already submitted for a randomized controlled clinical trial. We think that because we're going to have greater connection to the patient outside the clinic through this remote therapeutic monitoring, they're going to get better outcomes. And they're going to stay with you through doctor discharge as opposed to just leaving when they feel better, right? We want to have doctor discharge patients because we know functionally they're going to get a much better longer term outcome. But you can bill for the services when you're using the technology. So like, for instance, we've built in timers, so we know exactly how long my doctors at Kaizo Health are on the 2.0 app reviewing their patients' progress. When you reach a certain threshold of minutes each month, you can bill for those services. And we'll be talking about this more in 2023, but guys, research remote therapeutic monitoring, research remote patient monitoring, because these codes are going to be available to chiropractors in 2023. And literally Kaizenovate is leading the way. It's not a sales pitch, guys. It's really not, because we're actually not able to open, we're not able to open it up to all of our customers because we've only got APIs with very specific EHRs right now, which means a connection with the EHR, a technology connection, so that we can collect outcomes data. So it's not even going to be available to everybody, but for the lucky folks that have the specific EHRs, which we'll talk about in 2023, you'll be able to build these codes and you'll be able to generate revenue and get better outcomes with your patients because you're more connected to them digitally and in the office.
Yeah, and which lead us to the new technologies of 2023. Yeah, so what do you think that will be the best new technologies for next year?
I've done a lot of research on this, obviously, as well as it relates to our own product and just really understanding what the health tech landscape is going to look like in 2023. And I think there's probably not anything that's going to be new. I think the technologies that we currently have are probably going to be more widely utilized. So for instance, for us, a digital health app for patients and providers, blockchain, which is, I think, a really important development that started, probably 7 or 8 years ago, still not completely adopted in the healthcare space, but providing better security and transparency and eliminating the middleman. That's really what blockchain is designed for. And so I think we're going to see greater adoption of blockchain. I think we're definitely going to continue to see more gamification. Obviously, we're a big believer in it because we've seen the scientific literature and we've seen it in our own products and how it works to drive better patient behaviors. So I think gamification is also going to be something that's going to be more widely used and accepted. And again, lastly, big data. I think doctors are going to understand better how to use big data to make better decisions and to fight back against systemic issues in the chiropractic profession, whether it's regulatory or whether it's reimbursement. We're going to have access to information that we've never had before, and that's going to help us win these battles that we're constantly fighting. And I say that with full confidence because we've done that already. Like, we've literally won battles because we've had the data. I think doctors adopting big data is going to help us get even better.
Yeah, and I'm moving forward to some of your attendees' questions from your previous presentations.
Okay, let's
I thought that was I have fun ones, but I have more specific ones to the industry. So the first one is, how do I get caught up with technology in the office if I'm behind? So we already know that we have this struggle with some customers that they have the app, but they don't know how to use it.
Sure.
And others, we have chiropractors, they want the app, but they don't have people that know about technology and they don't know about technology. So what do you have? Tell us all about that, Dr. J.
Well, I think anytime you're using technology or you're changing your practice, you're evolving your practice, you've got to start with change management philosophy. I literally just talked about this in my last 2-minute drill. It's all about clarity. It's about clarity of why we're bringing in technology, clarity of the strategy and tactics that you're going to use, and clarity around getting feedback from the team to make sure everybody's bought in to actually starting to leverage technology. Look, I don't know what we would do as a business, because we've got multiple businesses. I don't know what we would do without technology, because it helps us do so many things more efficiently. So I think you have to think about the different areas of your business. So you've got operations, right? You've got clinical care and you've got marketing. And so what are the key technology tools that you need in each one of those areas? Like for us, operations, we use Microsoft 365. So we've got Outlook, we've got our email, our task list, our calendars, everything's integrated so we can operate really, really efficiently. Microsoft Teams, where, literally in a shift, the CAs and the doctors are communicating through Teams, so they're not running back and forth, which is really inefficient when they're taking care of patients. The second thing clinically, EHRs, right? You've got to have a strong EHR and practice management system. We use Genesis chiropractic software. We love it. There's automated workflow, so we don't have people managing people. We've got the system managing tasks to help people do their things efficiently. And we also have great reporting, data, and analytics inside of that operation, so we can see really important elements of our business, where we're succeeding, where we're not succeeding, and how to make changes. So using your EHR and also the clearinghouse data that Brad provides with Infinity, we've got an amazing dashboard where we can see like our average time to get paid for a claim, our average time to submit a claim. So if you've got an office manager, you don't know how long it's taking her to submit or him to submit a claim. Well, with Infinity, you have that insight literally in an instant. So making sure that we are using technology in the operational side and the clinical side, really important. And then lastly, marketing. So, you got to start with your website. Do you have a strong website? Do you have good SEO strategies? Because really you're gonna drive the winner of the game is always people who win on Google. And so you've got to understand how to have a strong website and SEO. We've spent a lot of money and a lot of time over the last year revamping our websites, revamping our SEO strategy, talking to consultants, and learning more about how to do that even better. So I think those are the three areas. I think individual providers have to make decisions about which is most important first. If it was me, I would probably start with the right EHR. That if you don't have that, I think you're shooting yourself in the foot.
Yeah, and I think also what people need to know in the industry and other industries too is to know how to leverage the technology they already have. Like look into the data, because we have struggled with some people that they think that having the technology will do the job for all the job, but you need to go over the data and see. Because like in my role, marketing is very important. Like data is very important in marketing, so we can optimize things and leverage things in the future. So yeah.
No, that's a great point, Manal. Thank you for sharing that. And you are world class at that. It's great to see how you report on our analytics and how you make decisions to move us forward. And just to give you guys an idea, like when we started with our LinkedIn newsletter for our 2-minute drill, we had 0 people. Right. And through Manal's work and looking at the data and coaching me up on what I needed to do better. How many people do we have following us on our LinkedIn newsletter now?
1,293 in 6 months.
Yeah. So, I mean, you can do it too, but
Yeah.
Manal's point, listen to her because she knows what she's talking about.
Yeah. And on a funny note, I just want to end this a very exciting session with you, Dr. J.
And we will get to your questions, guys.
Yeah,
I promise.
for sure. Yeah, I have those, and we'll get to those. Where do you get your hair done, Dr. J?
Where do I get my hair done? So, I didn't cut my hair through COVID, and like this is what happened. But I actually, when I do get my hair cut every now and then, like it's probably like every 3 or 4 months, I go to a place called Oasis, which is in Rockville, Maryland. My good friend Wafea, we've been in that same location in the same shopping center, for almost 30 years now. So yeah, it's crazy. So I've known her for a very long time. She's amazing. And she actually specializes in curly hair. Now, when I was in college, I had long hair, but it was not this curly. But so I had COVID, ended up getting COVID. My hair got long, and then I had COVID, and then 2/3 of my hair fell out. Do you remember that, Manal? Yeah. So like 2/3 of my hair fell out because, there's a condition when you have a high fever, it happens. It doesn't have to be a high fever related to COVID. It could just be any high fever. But when it grew back curlier. Like, I don't know what happened. And so, yeah, that's the story of my hair.
And how much caffeine do you have in a day? Because your speed is impressive.
Let me take a sip of coffee before I answer that. I drink a lot of coffee. I love coffee. It's like the first thing that I have in the morning. Don't tell Dr. Cindy Howard because she'll be upset with me. But yeah, I mean, I usually have about 2 to 3 cups of coffee a day.
Yeah.
So yeah,
Oh,
I love my
oh
coffee.
God.
Yeah, not that big, you know,
Yeah.
coffee mug size.
And last one, when is your book coming out?
So that's a great question, Manal, because I have no plans to write a book, even though everybody's pressing me to write a book.
Yeah, I know.
I know we've talked about it internally, and you know, maybe at some point, maybe at some point we'll get something done, you know, in 2025. You know, 2024 is going to be a big year for us, and so really want to focus my attention on our 2.0 launch.
Yeah.
But yeah, I mean, I have to really think about what I want to what I want the theme of the book to be. And I think sharing some of my journeys is going to be really important to help people. That's kind of my jam. That's why we do these webinars, because I typically just share like, these are the mistakes that we made. So don't make these mistakes, because here's how you avoid them. So anyway, maybe 2025.
It's on our plan, but we need to wait a little bit. Dr. J has a lot in his plate right
Yeah,
now.
so just so you know, like Manal and Jenna, they conspire against me. They're like, we're gonna make Dr. J do this, and we're gonna make him do that. Yeah.
So going to our attendees right now questions. So
Yeah.
we've got Michael Coates.
Yeah.
You want me to read that for you, Dr. J, or?
No, I'm looking at it. Yeah, I can. So
Yeah.
what is the most needed to get across for everyone outside the chiropractic profession, that science does in fact establish the benefits of chiropractic, to counter the horrid YouTubes like TED and other misinformation pushes? Yeah, that's a great question, Michael. I think it's incumbent upon us as chiropractors and as people that serve the profession like you do. For those of you who don't know, Michael runs a great company. It's called PI Made Easy. Check it out. Google him. Michael, you feel free to put your website in the chat. But he helps chiropractors, you know, address the concerns and the challenges that we face in working with personal injury clients. And we've worked with Michael. He's been a great help to us. He also, just like Brad, works on the Future of Chiropractic strategic plan. And so he's advocating for us, you know, every day. I think it's incumbent upon us as providers to educate our patients about the science and the benefits of chiropractic, and then encourage them to share that as well. You know, content marketing is really all about education. If you're doing it the right way, it's not about sales, it's about education. And so we work really hard to educate our community, whether it's digital or in person, around the benefits of chiropractic. So the more good information that's out there, the more it overshadows, you know, misinformation. So great question, Michael. Thank you for that.
Yeah, for sure. And we've got a question from Brad Coast. What are the top 2 events that all chiropractors should be a part of in 2023?
Wow, great question, Brad. So the first thing that comes to mind is Florida. FCA National in August is a great event. There's always awesome speakers, and you know, Brad and I speak at FCA, so there's a little bit of a plug there. But and I think Michael actually is speaking there, has spoken there as well. But FCA National is a great event. Is about 4,000 folks there, and you know, lots of great vendors and lots of great speakers. It's really strong. We did a workshop there last year that went really well. We had a lot of fun. We had great audience, great engagement, and you know, we were able to really create some significant impact. I think Parker has come a long way. Parker, I mean, what Bill has done, you know, at Parker has been nothing short of miraculous. He has gotten some of the great speakers. This year, Angela Duckworth is going to be there. He's had Michael Phelps there in the past. So definitely check out Parker in January. And then in between that, by the way, I don't even know, maybe Brad does know this, so maybe he gave me a softball, but we are having our first event ever.
Yay.
On May the 6th, we're doing our first in-person event in Washington, D.C. You know, it's really easy to get in and out of Reagan. The flights are inexpensive, and we're going to do it right near Reagan within 10 minutes. So, you know, the hotel prices are not bad. And we are going to have a list of speakers that's going to blow your mind. It's going to be everything from what's happening in chiropractic and healthcare moving forward in 2023, to leadership mastery, which is a course that I teach, to what's your story, which helps you think about and communicate your brand so that you are able to attract and retain more new patients, to Dr. Kevin Christie, who's going to be also talking about digital marketing and how to do that super effectively, to Christy Cook Hudson, who is going to be sharing her secrets around compliance and documentation, specifically around the codes that I mentioned earlier, remote therapeutic monitoring codes and remote patient monitoring codes. We want to make sure that our doctors understand, you know, how to build these codes and how to document it appropriately. And so, yeah, May the 6th in Washington, D.C. Just if you're not on our email list, go to our website, you know, sign up for our email list, and you'll get that information shortly.
Yep. Do you still have any questions for Dr. J?
I love what Sam said. You should write a book with all your free time. Sam is also
Yeah.
one of our customers, and he's a great guy, has a great practice in Virginia, as is Dr. Rodden. He's got an amazing practice in Virginia as well. And it's a privilege to work with people who are not just outstanding chiropractors and making a difference in the world, but really people that I absolutely love. I could cry right now. Like I get that emotional when I think about these people that we get to work with, Manal, because it is really a blessing.
Yeah, for sure.
Yep.
Yeah.
Well, guys, I think we're 7 minutes overdue, right? We
Yeah.
went a little bit long today, but does anybody else have any questions before we hop off?
And just as a side note, we are running our biggest sale ever this year. So this is our highest discount for the Canvas app for anyone who wants to be part of our journey and have the Canvas app on their practice. So that will be 60% off. We never have done this before. And also I'm working on a couple of gifts for you, and I'm working on a Spotify playlist for your holidays. So just I'll keep you posted, and if you, as Dr. J said, if you're not in our list, please go to our website and sign in.
Cool. Guys, thank you so much. This has been a great year. If you guys ever need anything, you know how to get a hold of me. So don't hesitate to reach out. We're here to serve you and make sure that you can attain the highest level of success possible. So much love and appreciation for you all. Have a great and safe holiday season, and we'll see you on the flip side in 2023.
Yep. Thank you.
Bye, guys.
Bye.